am. Hello, my name is Tina Hill and I am currently a student at Western Governors University. Today I will be making a presentation about coping with lupus. As I make this presentation, you might have questions, but I ask that you save them until I open up the questions and answers segment of this presentation. Thank you. Now, those diagnosed with lupus should seek medical treatment regardless of the number of doctors needed to manage the symptoms or the amount of time needed away from work, because left untreated, some of the subdiagnoses could result in death. It is incumbent upon the patient diagnosed with systemic lupus erythematosus, or SLE as it's often called, to understand the necessity of obtaining multiple treatment therapies in order to manage disease-related issues. The need for treatment therapies is based on the condition, and every person diagnosed with SLE will have a different experience throughout the course of the disease. There may also be erroneous misconceptions from friends, families, and physicians that SLE patients are obsessed with his or her condition due to the frequency of visits to medical professionals. To maintain independence, SLE patients can spend a substantial amount of time and effort caring for health-related issues. Understanding lupus is very important in terms of dealing with all that comes with this particular disease. Often, lupus is described as the body becoming sort of allergic to itself and healthy tissue attacking other normal healthy tissue. The Lupus Foundation of America, an organization dedicated to providing information about SLE, describes it as a chronic inflammatory disease that can affect various parts of the body, especially the skin, joints, blood, and kidneys. Since there is no cure for SLE, once a person is diagnosed with this disease, he or she has it for life. Hence, it is called a chronic condition. At times, more frequent doctor's visits are needed to carefully monitor symptoms and to be aware of any complications or side effects caused by medications. Doctors recommend that patients sometimes see doctors as frequently as weekly, depending on how aggressive the disease is. Let us refer to the bar graph of subdiagnoses to understand what types of patients might need to seek additional treatment therapies. The first column is chronic pain. And chronic pain is one of the most frequently reported problems among SLE patients, with 85% reporting arthralgia. Extreme physical pain that is associated with SLE is mostly treated with pain medication and rest. Obviously, this kind of treatment would require some time off work to manage. The next we have is skin complaints. 60 to 70% of lupus patients report some skin complaints, which might need to be treated by a dermatologist. Also, we have kidney complications, and it's estimated that 40% of all patients with lupus will develop kidney complications that require medical evaluation and treatment, usually from a nephrologist. One author also pointed out that 30% of patients develop a second, third, or sometimes even a fourth autoimmune disease, such as Sjogren's syndrome, hypothyroidism, or antiphospholipid antibody syndrome, and that is actually represented with 30% here. Also, it is believed that 20% of all lupus patients have fibromyalgia, which is a pain amplification syndrome characterized by fatigue, a sleep disorder, and tender points in the soft tissue. Incidence of acute psychosis is between 10 and 15% during the course of the disease. So, in many ways, lupus affects independence and the ability for SLE patients to work. Not only do SLE patients miss a lot of time from work by going to visit specialists for treatments, but patients also have to deal with other issues related to the disease. Lahita and Phillips explain that due to extreme physical and psychological symptoms, some people who have lupus cannot work. In conclusion, lupus is a complicated and unpredictable autoimmune disease, and research shows that seeking therapeutic treatments for lupus will decrease a patient's mortality. Even if there is a misconception from ignorant family, friends, and physicians that SLE patients are obsessed with seeking treatment, patients should diligently try to acquire the help needed. Those diagnosed with lupus should seek medical treatment regardless of how many healthcare providers it takes to manage the symptoms or the time off of work, because left untreated, some of the subdiagnoses could cause death. Now, are there any questions?
Yes. How can a person with lupus keep a job and still get all this medical treatment?
Very good question. There are government laws that were created to protect people with chronic disabilities from a loss of employment. And according to the Americans with Disabilities Act, companies with more than 15 employees must make reasonable accommodations for persons with special needs. Any other questions?
Are there any other reasons besides doctor's appointments that cause lupus patients to miss work?
Thank you for your question. SLE patients have periods of acute symptoms called flares, and that's when the symptoms worsen and cause the patient to become totally incapacitated. During flares, specific organs such as the kidneys, the lungs, the joints, or any other part of the body can be damaged. This concludes my presentation. Thank you.